Welcome to This is Freedom, a podcast where we talk about mental health, spirituality, and finding freedom in our lives. We join with guests to discuss topics that challenge our mental health and spiritual health, and we explore holistic ways of coping. Here we are sharing stories and inspiring a journey of freedom. I'm your host, Michelle Solomon. Today's conversation is very important to me. I'm talking to my sisters. I have my sister Sherelle and my sister Joshua with me, and we're going to be talking about supporting a loved one living with mental health challenges. So welcome Sherelle and welcome Joshua. Thank you for being here with me today.
Thank you for having me.
Very special. So, Sherelle,
Yes.
Tell me a bit about yourself. Why did you decide to join me on this podcast?
Well, you asked me, and you're my big sister, and I can't say no. I have to support your podcast. I think it's a great thing that you're doing, talking about all things mental health, and obviously we've been around for some time together.
Yes.
The majority of our lifetime. Well, all of my lifetime I've been with you, and I thought it would be cool and fun to actually sit down and have these conversations. I don't know if we've ever sat down, the three of us, and had a conversation about this subject matter specifically.
No, we haven't.
I thought it would be very enlightening.
I apologize because we do all sound very much alike. I also have my younger sister Joshua here. And Joshua, tell the listeners a bit about yourself and...
Speak it to the microphone.
Hi everyone, my name is Joshua. As Michelle indicated, I'm her little sister, about 7.5 years apart. I decided to join Mishi on the podcast to support her and her mission to destigmatize mental illness and to have people in the Black community talking more about mental health and really mobilizing support for our loved ones and really showing people that there's another reality out there when you have a really loving and supportive circle around you.
Yeah.
Mm-hmm.
And your dissertation about youth and spirituality and mental health really speaks to me, and I was really excited to explore how my spirituality has impacted my mental health and see how my sister's has as well. And compare and contrast, because we come from very similar backgrounds, of course, but we express it differently.
Yeah. Actually, let's tell them where we came from. Our maternal grandparents are from Trinidad and Tobago, and they immigrated to Canada in 1969. We grew up in a very close-knit family where our grandparents were very faithful. They both attended church regularly and instilled in us values and beliefs in God. And there was always reverence for God, praying before meals, attending church, and just knowing that we were loved by God and Jesus. And that was very foundational to us. My grandmother was also very much a singer. She sang constantly. She sang hymns. And that's how I really came to have a foundation. On my paternal side is from Guyana. And my dad came to this country. Year did dad come here? 1968. My parents met in Montreal, and the rest is history. So I came first, Sherelle came second, big three, and Josh came last. And we were very excited when she came along. It had been some time. So,
You named me.
Yes, I did name you.
I tell people often.
Yeah, that's always a big story because her name is Joshua, and we thought she would be boy, so she was going to be Joshua. And me being the voice of reason said, well, what if it's a girl? It rhymes with Michelle, Sherelle. How about Joshua? And my parents were like, Eureka, that sounds great. Decided to go with that. But we all went to Western University and were able to stay pretty close-knit. We came together, and Joshi joined us later as well. I wanted to bring my sisters on today also as not just my sisters, but they are very knowledgeable professionals that have worked hard and really care for people as well in different ways. I'm a nurse, Sherelle is a family doctor, Joshua is a doula, and together we're like this trio care team, and I really value their perspectives and things that they've come across in supporting the mental health of their patients as well. But today I really wanted to highlight the experience of being a sibling and supporting a loved one who's gone through mental illness, and wanted to hear my sister's perspective. You know, we haven't always had a chance to really or purposely sat down together to talk about our own mental health and spiritual health, and so we're going to get into it. So back in episode 2, I talked to my mom about my experience in high school and the sudden onset of my symptoms and what that was like for me and what that was like for her supporting me. Now I'm here to talk to my sister Sherelle and find out more about her perspectives. And this is something I haven't actually asked my sister. We haven't talked about it so much. We've had conversations here and there, small ones. So, Sherelle, what was it like supporting me back in the day when we were in high school and I started to act different? Like, what were you seeing? Do you remember what that was like for you and how it affected you?
Yeah, I have certain memories, and there's other memories that I don't know if it's the right word to say they're repressed, but there's other memories I don't recall until someone brings it up or reminds me. And then I'm like, oh yeah, that did happen. I was young. I was like 11 or at the time. And it was a long time ago.
13 maybe?
Yeah.
Yeah, you were like 13 because I was 15.
Yeah, but I was young nonetheless. And, you know, so my world was very small at the time and my experiences were few. Mm-hmm. And I had never had any experience with anybody any type of mental illness or health challenge. I never seen what depression looks like or what anxiety looked like as such, for less psychosis in the setting of bipolar disorder. It was all very foreign to me. All I knew was that you were my sister and you were acting different than how you normally would act, and I didn't know what was going on. So I feel like I had to support you just as my sister, not as supporting someone with mental illness. You know, I was just supporting you, you know, as you were going through the changes that you were going through, even though I didn't know why they were happening. Yeah. So for me, I guess, yeah, it felt like I had to be your, like it was time for me to take action, you know, to be your sister, not just relationally, but to support you in whichever way.
There's a particular moment which was kind of a turning point that Mom talked about. There were also times when I would just leave the house because some of the symptoms of bipolar disorder is mania, and mania is really like increased energy and goal-directed activity. There could be agitation, and there could be things like increased spending. I felt like I was jumping out of my skin at times, and I would leave the house. And Mom talked about there being an alarm system, and the alarm would go off, and they were like, well, who's going to go after Michelle today? And you guys would have to come and try to find me where I was. So I know that was something that you did. You kind of became, for that period of time, like a guard. Like you were making sure that I was okay and following me.
Yeah.
I think you followed me certain times to see where I was going.
I feel like I'm very protective of my sisters, and I wonder if that's when that started. But yeah, I would follow you. Usually my mom, our mom.
My mom,
as we affectionately call her, would just give me that look. And I said, okay, Mom, I'll go. And because she would just leave the house, you know, even though obviously she was asked not to or whatever, but she would leave. Yeah. And
Michelle.
And I would follow Michelle and stay, you know, close enough that I saw where she was going, but far enough that she didn't notice me. And of course she would notice me at some point. And she would turn around and say, Sherelle, stop following me, go home. I can laugh at it now, but I never felt comfortable going home. I always wanted to just kind of like stay back or go back home when a reporter came, Michelle's here, Michelle's there, Michelle went to this person's house.
You're like FBI.
Yeah.
Reporting back.
Just wanting to make sure that she was okay, you know. I remember, I don't know, some early memory. I think my earliest memory incidents were of psychoses. Those were the things that I remembered the most, and those are my earliest memories of seeing you changing in a way that I didn't know what was going on, and I was scared.
Yeah.
I was actually fearful. I remember you being in your room, and your room was not obviously, but it was next to mine. Of course you were next to me. Your room was, pretty much next to mine. And I remember you being in your room and just talking. And this is, of course, for you young folk, before cell phones, before there could ever be a way to talk to somebody in your room if you didn't have a landline in your room.
Yeah.
Good point.
So she was just in her room talking. And it was nonsensical things. It wasn't, there were words, but they didn't make any sense. And she was talking a lot, and I knew there was nobody in there. And I remember her being like, Sherelle, come here! And I remember hiding under the desk, I think in my room, because I didn't know what in the world was happening.
Yeah.
Yeah. I remember being very fearful. I don't remember ever shedding any tears or being sad about it. I remember being confused because the person who was my sister up until that point, all of my life, was now this very different person. And I was afraid that I would have my sister back.
Yeah.
Yeah, I was afraid that I wouldn't have Mishi back if this was like a permanent change. And I would not get my big sis back. And I didn't know what to do or how to help you. And even looking to my parents, I know that they didn't know what to do. So it was a very helpless feeling. At the same time, not understanding what was going on, even as a child, but even for the adults around us. Yeah, even for the adults around us, even they didn't know what to do or how to help you.
Yeah.
And that was a scary time of my life.
Yeah.
Yeah.
I remember you saying that I had changed after that moment, and although I was still me, I was still different. In what ways was I different?
I knew you were going to ask me this question, and I was trying to think of a response earlier today. And I just don't know how to put my finger on it.
Yeah. Yeah.
It's hard to discern the reasons or the specific aspects of you that were different and others that were not. Obviously, the core of who you are and your personality and everything were the same. But then there's also just growth that happens and maturity and change as you get older. So I don't know how to answer that question. It was different.
Yeah.
When you were going through the acute mania and psychosis, and then when you got stable, you were still different at that point. Not in a clinical, psychological way that could be discerned by saying you were having these symptoms or positive or negative symptoms of this or that. It wasn't really discernible to me. It was just, you just seemed different than what I remember from before.
Right.
It was also a time of puberty and things like that. So there's so much going on.
Yeah.
So we were both different.
Yeah. I mean,
we were
high
both
school.
different at that point. It changed me. At the same time, it changed you, even if my biochemistry hadn't changed.
Yeah, I mean, in high school is a time of great change, and a lot of students go through difficulties at that time. Because I had it was such an extreme change in my mood and my behavior and even my personality a bit. Like, I remember going on the medication and that making me very tired and changing who I was. At one point got me off of medication because I completely didn't feel like myself, which I'm glad that she did, because once I got on lithium, I started to feel a lot more like myself again. So for those of you listening, if you ever, you feel different on your medication, you don't feel like yourself, sometimes, yeah, just having fatigue because of some of the medications, whether it be antidepressants or antipsychotics, can cause fatigue. And that's something that people have to push through, and it's not easy. But, a medication shouldn't be changing who you are to the point where you don't recognize yourself and you're just not interested in things that you used to be interested in, or you're feeling just different and not the same person that you were. It's always an adjustment to take medication, something that's foreign, and to have faith that it will help you. Because I obviously needed help. I think on both ends, the psychosis was scary for me as well. I had thoughts of, if you go back to episode 2, there were thoughts that my dad was poisoning my food, or that if I flushed the toilet, a bomb would go off, or that there were cameras watching me. And
delusions.
Yeah, the delusions. Exactly.
Delusions. And to me, when you have a delusion, when someone has a delusion,
yeah,
they're not having a delusion in their perspective. They believe.
Yeah.
They believe this.
They believe it. Yeah.
And I don't know if you've ever had somebody come up to you telling you something that they truly believe, but it's quite convincing.
Yeah.
And so for me, as your sister, I remember you coming and being like, Dad poisoned me. He put poison on my toothbrush. And you were so sure of it. And I was like trying to discern, is this true or is this not true? Why would Dad do this? Oh no, this can't be. This must just be in Michelle's head. And I was just trying, at one point I was just kind of like suspicious now of Dad. Is there something going on? I don't know now. Trying to make sense of your delusions.
Yeah. So,
not knowing that it was a delusion.
So delusions are fixed false beliefs that a person thinks are true. It's their reality, but it's not actually the reality. So they could be things like someone's following them, or that they're the next Messiah, or just any real situation that they think or perceive to be true, and then they're actually responding to it and reacting to it as if it was true. And it can be very distressing for the person. They're usually, in my experience as a nurse, they're usually negative things, not positive things. Someone's trying to follow you to hurt you or get you, not something positive like, I don't know, I just won the lottery and I'm rich and I can pay for things, which have been people's, delusions as well. But they're really true to that person, and it's really hard to live like that, to live in a different reality compared to the people around you, or to be able to really function, to continue going to school or work. Now, some people may learn that their delusions are not real, especially if they have like a long, like a psychotic disorder or a schizophrenia or something where there's like a permanent, more of a long-term delusions, but they may learn that they're not true and learn to live their lives discerning between the two things, the reality and their delusion. So thankfully, it wasn't a long period of time. That's why early intervention is important, to get help very, very quickly. And I'm really grateful that I had help from my mom and that she was connected to a psychiatrist because of her work in behavioral medicine. So things were picked up pretty quickly, and I got the help that I needed. At this time, Joshi, you were probably, Sherelle was 13. You were only like 7. Do you remember any moment at all or anything besides playing with your toys? And I don't know. You always say that as your big sister, your memories of me and the things that you used to do were very sister-like things. Poking at me when I was sleeping, or I don't know how much this really affected your world at that time, and how it, or maybe even just your perception of mental illness, knowing that I did experience it. Not really maybe remembering, but just knowing that mental illness is something that people can encounter. I wonder how it's affected you.
I think because of our age gap, my earliest memories don't often include you, because you're hanging out with your friends, or you're playing with Sherelle and I'm alone in my room and I'm with my grandparents, and you know, I'm doing something completely different than you guys. But I do recall waking up in the middle of the night and seeing the light on underneath my door, and opening the door and hearing all of this commotion downstairs, and thinking that I'm, you know, sneaking over to the stairwell to eavesdrop and figure it out. And I knew it was a tense situation. That's why I felt like I should be hiding, or I should be remain undetected. And there was a really big tree in our foyer.
Oh yeah, I remember.
And so I kind of snuck up to the railing behind the tree to listen to what was happening. And you were trying to get out of the door, and Dad was holding the door closed, and Mom was upset, and Sherelle was awake, and there was just a lot of movement, and I was scared.
Yeah.
And I asked Mom if she remembers that, and she's like, I knew you were there. She's like, you weren't as sneaky as you thought. But that was a big memory for me. I knew that there was something wrong, and I didn't know how it was affecting you every day. I knew that I had never seen our parents look so distressed and frustrated, and that was scary.
Right.
And they know there was no resolution. I imagine that someone came to me and comforted me and got me back into bed, but that's not the part of the story that stays with me, you know? And then I also recall that I had my 8th birthday or 9th birthday. We bought a cake from Fortino.
And I wasn't there.
And you weren't there. Yeah.
I remember that now. I wasn't there for Josh's birthday.
Yeah. And it was a weeknight. And we were getting ready for dinner, and we were going to have our normal, that's usually how we celebrated birthdays. We didn't do huge parties. We would just have cake after dinner. And you left to go somewhere that I didn't know. And I was sad that you weren't around. And but I knew, or maybe this is after the fact, I don't know, but I think I understood that if you were of sound mind, you would have been there. You know,
must have been a good reason for you.
Yeah, exactly.
Yeah.
Yeah. And then growing up, honestly, like, mental illness has been so normalized for me, and I think I have to remind myself of that sometimes, because I perceive other people's stigma, or I'm talking to someone about anxiety or depression, and I can speak very casually about these things because I've been learning about it for so long, and often folks are either surprised by it, or they kind of get quiet because maybe they haven't released those ideas that these things should be hidden, or these things should remain behind closed doors.
Right.
So I recognize that it's almost some sort of twisted privilege that I understand.
Yeah, twisted privilege.
That I understand that people are not their mental illness or their mental health challenges.
Yeah.
That's part of their lived experience, but it's not them in entirety. And
yeah, that's so true. I think, after Michelle got diagnosed with bipolar disorder, like after the fact of all the acute presentation that led to the diagnosis, I also got sick, not with a mental illness, but a physical illness with Crohn's disease. And like to what Josh is saying, you are not your illness. You're not your mental illness. You're not your physical illness.
No.
If you have, whether you have diabetes, or you have schizophrenia, or you have infertility, or you have psoriasis, you are not that. It's a cross that you bear, but that is not who you are. But at the same time, if we allow it, we can make those experiences count for something good in her life. And that's exactly what Michelle is doing right now with this podcast and in her whole life, really.
Yeah. Oh my God. Like, it honestly shaped
of life.
It shaped so much of my life, because honestly, it was a huge impact. It was a very significant shift, and it had a huge impact on me in negative ways and in positive ways, because it allowed me to see that in life sometimes things just happen to you. It's not because of something you did, or because of your parents or whatever. Like, there's multiple reasons why people get sick with different things. There's genetics, there's trauma, there are early childhood experiences. Yeah, parenting can affect our mental health, but it was something that I didn't really stop to think about at first. Why me? Or how did this happen? Or why did this happen? I just had to keep going. I just had to eventually walk out of any stigma that I held, because I kept it pretty quiet, at first. People close to me, my close friends in high school knew. Actually, I had a friend that was really close to me, and she understood the illness. And by the time I got to university, I was tired of hiding behind the mask and of what I had experienced, because I worked really hard to get into nursing. I would get up and go to school and be super tired because of the medication. I had to reduce my course load. It was hard for me to concentrate because the medication kind of slowed me down. It kind of slowed down my thinking. And honestly, my family was a huge support. And, at that time, when I look back, I'm really grateful that Sherelle was there, because I didn't know where I was going. When you have mania, you become really closed off. You kind of lose your insight, essentially, and your sense of danger and risk. And that can be really, really dangerous. Some people get into some really precarious situations because of that. And because I had my sister and, my parents keep an eye on me, that really helped. And just knowing that they were there for me, even though they were scared, because we all didn't know what was happening. I didn't know what was going on. I was just living my life, and then all of a sudden this happened. So, yeah, but, things happen to us, and we have to keep going. And at the same time, high school was a time in our lives where we also became born again, and we chose to follow Christ. We were all baptized in the fall in one of my high school years. And so it was also a time of 2003? Yeah,
October 31st.
October 31st, 2003. And it was also, like, honestly, my high school days were actually also very fun. Like, I enjoyed high school. Yeah. After I was on the right medication, I did well, and I had fun, and I was just like a teenager, and I was involved in the cross-country team, and I was involved in band, and I did different things. So I actually did have really great memories from high school, and this was it was one experience out of a whole bunch of experiences. Yeah. And I think that was because of the support system that I had, and the way Mom advocated for me. And the school too. The school was actually really good as well, and how they responded and worked with Mom. I'm very grateful for that, and I'm very grateful now just to be talking as a Black female and wanting to raise awareness of the experience of mental illness in the Black community. I think it's important for us to hear from each other and to support one another, because you have to reach out and get help when you're not feeling well, when your family members, your sister, you know how they act, the ins and outs of your family members. And so it's important to pay attention, and we have a lot more resources now, and I think the dialogue has become better. But I'm still concerned for the African Black Caribbean community, because mental illness is still something that isn't always talked about.
So true. In so many cultures, so many backgrounds, there's such a stigma. I was just listening to CBC radio even, and it was talking about, it's not even about mental illness, but it was about an Iranian man who was homosexual and had to flee his country and leave his family because they tried to kill him because of it. And he had to come to Canada and start a new life for himself because he couldn't hide who he was anymore, and he wasn't being accepted. But yeah, I hear it a lot, even In my profession as a family doctor, as part of just taking a history, especially when it is a mental health visit, and asking about mental illness in the family. And more so than not, there won't be any identified mental illness. The patient will usually say, well, my mother probably has bipolar disorder, and my dad probably has depression and anxiety, and my grandfather definitely had some type of schizophrenia or something, but nobody was diagnosed in those days, and not even those days, not that long ago, or got the necessary attention that they needed. And it's only really the current generation where there's more of like actual diagnoses and management when it comes to, yes, my brother does have ADHD, he's on this. My sister has depression, she's on this medication. But for the older generations, it's really hard to pinpoint what the mental illness family history is. And it's very hereditary, some mental illnesses. You know, even so much so that if someone says that their sister tried this medication and did well, let's try that with you, because it's likely that you'll do well as well on that, or it's at least a good starting point. So it is important to know our family histories if we can, and to have those conversations, I think, with our family members. And oftentimes they might be uncomfortable, but we might learn a lot, and it might kind of plant a seed and open up a door to kind of kill that stigma.
Yeah. Thank you for that, doctor.
I think also when you think about our different ethnicities and cultures, people have different terms for things, and you know, different, like in different languages, things don't translate exactly the same, and I think there can be some barriers to communication there. But if Granny was to say that someone was mentally unwell, what would she have said? Like the gone in, or like you know, that it's just this ambiguous language that
she was different.
Yeah, they were different.
She did her own. She did things differently, or she had her own.
Yeah, I think that there is different.
He lock up in your room. If someone's depressed.
Yeah.
You know, they would just describe what they're doing, not like.
Yes, that's true.
Anything beyond that.
I don't think, not even so much to say that they weren't really diagnosed, but I don't think there was even an appreciation for this being an entity, like mental illness being a thing. Like being an illness.
Right.
Depression even being an illness.
Yeah. Right. Yes, exactly.
You know, thinking that it's something that you can, you know, that you can control easily, or that maybe it's ingrained in just who they are, their personality. You know, that's just how they are. That's just so and so.
Yes. Yeah.
They do that. You know.
Yeah.
As opposed to thinking that this is something that can be helped and.
Yeah.
Yeah.
You know, it's something to say for that, because I feel like on one end there is a more, I don't know, maybe an acceptance of people and how they are, and that's just uncle whatever, and you know, they're locked up in the room, or that's just that's just how they are. I feel like maybe there was more acceptance of people when there was less education about specific symptoms and the names that came from, you know, this European DSM that was mostly geared towards white males. I have this kind of theory that now that we have more information and we have so many labels to things, it can cause like an increased awareness and understanding of things so that we can get proper treatment. But I also think that it can cause division and kind of like this labeling people and putting them into boxes. Instead of seeing people as, there's just so much diversity, and, you know, accepting the differences that we see. You guys were very helpful to me. Although I've been very well for a long time and was able to come off medication, we all still have challenges. Situations can cause depression as well, not just our biology, but our environment. You know, big changes to relationships, loss of relationships, loss of work, COVID, poverty. There's so many things. Thank you for listening to episode 4, part 1, and we have more coming to you on Monday. My sisters and I will be talking more about how we find meaning and purpose in life today, Although we've all grown up in the same family, we have different ways of expressing our spirituality and experiencing it. So we're going to tune in more into that and talk about how we're finding freedom in our lives today. Thanks for tuning in. I'm your host, Michelle Solomon. Take good care and see you next time.